So welcome to a new video. So today in this video, I will discuss with you all about a very important topic that is very much useful for your clinical practice. So here I'm going to talk in about two signs in the eye that we most of the time get confused. That is, one is conjunctival congestion and another is circumciliary congestion. So most of the time while doing the slit lamp examination and when we see this redness in the eye in the specific conjunctiva, we get confused whether it is a conjunctival condition or circumciliary condition. So this is why I thought that I should upload a video in this topic. So let's start. So we will first start with conjunctival congestion. So a congestion is when the white part of the eye that is known as conjunctiva become red and where the blood vessel become in a dilated manner or swollen. So this happens due to irritation, inflammation, or infection to the surrounding structures of the eye. So this conjunctival congestion is pretty common and it is often indicate that something is bothering the eye and you need to examine it very carefully. Okay. So if I tell about the features of this conjunctival congestion, then first is the redness is usually diffuse and it's spread out the entire conjunctiva. So it's more intense near the fornix and less around the limbus area. That is the specific typical sign of this conjunctival congestion. And another is blood vessels look like bright red and are superficial in this conjunctival congestion. And if you apply the vasoconstrictor drop like phenylephrine, then the blood vessel will get constricted. So because of that, the redness actually reduce. So this thing happen in conjunctival congestion. So let's see some cases or clinical pictures of this conjunctival congestion to understand it very nicely. Okay, so let's start. So first, this is a case of adenoviral conjunctivitis, where if I tell about the slit lamp finding of this case, so here first is the eyelid is quite appearing in an edematous, and there is conjunctival congestion is present in the conjunctiva as well as you can see the chemosis also, and watering also can be visible, but the cornea is clear. So here in adenoviral conjunctivitis, you will see a conjunctival congestion. Okay. So this is a case of bacterial conjunctivitis where if I tell about the slit lamp finding, then it is the edematous eyelid with matted eyelashes, and in the conjunctiva, it is a conjunctival congestion with discharge, but cornea remain clear and it is unaffected. But if the patient continues with this condition for a prolonged time, then this can lead to several complications in the cornea also. So this is why proper diagnosis and treatment is very important in proper time. Okay. So here, this is the case of allergic conjunctivitis. So allergic conjunctivitis here also you can see the conjunctival congestion, which is a diffuse congestion, and watering is there. And if you evert this eyelid, then you will see papillae on the UTC. That is a sign of allergic conjunctivitis. And specific, if the patient is having allergic conjunctivitis, then he will give you the history of itching, frequent itching of the eye. Okay, so this is the case of allergic conjunctivitis. Okay, so contact lens induced conjunctivitis can also lead to conjunctival congestion. Okay, where the congestion become more in the fornix area, but in the limbus there is less congestion is there, and the congestion is quite spread all over the white part of the eye. There is a conjunctiva. Okay, and it is superficial. So if you push the vessel, it will move also. Those dilated vessels will move. It is indicating it is a superficial type of congestion. Okay. So this is the case of infectious keratitis. So here you can see the edematous eyelid with matted eyelashes can also be visible here. And conjunctiva having conjunctival congestion. There is in the cornea here is infiltrates with epidefect, and here quite thinning is actually started, and you can see the margins are quite sharp manner. That is quite indicating it can be a case of bacterial keratitis, but you should not go to a final diagnosis until you send the patient sample for diagnosis. So here, corneal scraping is very much important. Okay, you can see the corneal edema also, and quite hypopyon is also visible. So it is a case of infectious keratitis, and here you can see conjunctival congestion also. Okay, so let's talk about circumciliary congestion. So circumciliary congestion, which is also known as ciliary congestion, it happens when the deeper blood vessel around the cornea near the limbus become dilated and inflamed. So here this is the limbus. You can see the dilated vessels around the limbus. So this creates a reddish or purplish ring around the cornea and is usually a sign of more serious condition. So if you see a patient having circumciliary congestion, is quite a telling you that it is this condition can be a more serious condition because deeper blood vessels are now getting affected, and in this case if you try to push the eyelid with a blood vessel, then the blood vessel will not move, and even after you put the phenylephrine such kind of drug, vasoconstrictive drug, then also the congestion will not go. So it can be one sign. So if I tell about the features of this circumciliary congestion, then it's focused around the limbus. You can see the limbus is quite getting affected, where the cornea meet. So limbus is the area where the cornea and sclera meet, and fornix is the area where actually the eyelid and conjunctiva point is also known as fornix. So here fornix is quite loose type so that it allows the eye to move properly. Okay. So here this redness appear in a more purplish manner rather than appearing in a bright red because deep blood vessels are getting affected. So let's move to the signs of multiple pictures, right? So here, so yes, this is the case of acute anterior uveitis, where you can see a circumciliary congestion here. And what is uveitis actually? So uveitis is the inflammation of the uveal tract. Uveal tract includes uvea, choroid. Uh, there is a uvea include the choroid, iris, and ciliary body, right? So inflammation of any part of the uvea is known as uveitis. So inflammation of iris is iritis, inflammation of ciliary body is cyclitis, and inflammation of choroid is choroiditis. And inflammation of iris and ciliary body together is known as iridocyclitis. Okay. So anterior uveitis include iritis and also iridocyclitis, where you will see circumciliary congestion and in the cornea. Many of the time, if the patient is having uveitis, you will see capes on endothelium or pigments on endothelium. And also, if the patient is having an uveitis for quite long time, then iris pattern is also appearing in a muddy manner, and you will see cells and flares in the AC by in the, when you do the parallel pipe illumination. So it is, and also in many cases, uveitis also can lead to hypopyon. Okay, so proper diagnosis is very much important for the proper management. But this video is totally focused on congestion, so I will only tell about the congestion. Okay, so here the congestion is more in the limbus area than the fornix area, and so this is the thing actually. So here this is a case of scleritis. So in scleritis, you will see a localized limbal congestion is there, but the congestion is less in fornix area and more in limbus area and is quite localized manner. So what is the best way to differentiate between this scleritis and uveitis, anterior uveitis, is that you just see the congestion pattern. So in anterior uveitis, you will see 360-degree circumciliary congestion, but in scleritis, you will see a localized circumciliary congestion is there. So there is a first difference. If you take the history, then scleritis patient many of the time or maximum time they give history of arthritis, joint pain, such thing. Even after the arthritis can also lead to uveitis, but uveitis can also have other causes like tuberculosis, sarcoidosis, lung infection, etc. So you need to take history properly, okay? And let's move to the other case. So here, it is also a case of infectious keratitis where you can see there is a, if you stain the cornea with fluorescent strip, so it will show you that it is having a epi defect with infiltrates are also there. And here surrounding it, you will see the corneal edema, and you can see the hypopyon is also there. You need to measure it properly. And here, in case of infectious keratitis, in the last infectious keratitis case that I showed you, and the conjunctival congestion, it was showing the, what to say, conjunctival congestion. But this infectious keratitis is showing the circumciliary congestion. Okay. So this is very much important in writing how you are writing. Suppose you are making a case summary or case report on this case. So the finding is very much important. Okay. So that thing actually you should take care very well. Okay. So that's all friends. Thanks for watching and please don't forget to like, comment and subscribe to my channel. I hope this video helped you a lot in understanding this conjunctival congestion and cilliary congestion. If you have any question, then you can drop your question in the comment section and I will definitely give you the reply. Okay, thank you so much for your kind listening.